So Ed and I want to spend just a few minutes making sure we all understand what DCE and REACH actually are. Ed, what are DCE and REACH?
Thanks, Anna. DCE stands for Direct Contracting Entities. Direct contracting is a new program that was launched by the Trump administration. It hands traditional Medicare over to Wall Street investors. Direct contracting inserts new for-profit middlemen called direct contracting entities into the medical care of seniors and people with disabilities, supposedly to manage your care. But we know that when for-profit groups say they're managing your healthcare, they really mean that they're getting in the way of your healthcare. They're redirecting you. They're trying to make a profit off of you. We've seen this before, and it's dangerous. There's been a lot of opposition recently to DCEs and REACH by healthcare activists, and the Biden administration responded in part by changing the name direct contracting to ACO REACH. But other than the name change and a few cosmetic changes, we see little difference between the DCEs and REACH. They both basically hand traditional Medicare over to Wall Street investors. So this is being done to people in traditional Medicare. But many people today in Medicare are in Medicare Advantage and don't actually have traditional Medicare anymore. So maybe we should explain the difference between traditional Medicare and Medicare Advantage first, because it can be confusing. Anna, can you help with that?
Sure, I'll try. About half of the seniors on Medicare choose to stay on traditional Medicare, also called original Medicare. Now, in this program, patients go to their doctor, the doctor bills Medicare, the doctor gets paid, no middlemen, no prior authorizations, no denials or delays, simple. Other seniors choose a Medicare Advantage plan. Medicare Advantage is the version of Medicare run mainly by commercial insurance companies for profit. Now, for some people, Medicare Advantage costs less at first, but the trade-off is that when you get sick, if you're in a Medicare Advantage plan, you may face prior authorizations, denials, and delays in care. Medicare Advantage costs the government more, threatening to bankrupt Medicare, and does not deliver better care. Sure, Medicare Advantage plans can sometimes offer inexpensive extras like vision or a little dentistry because they're seriously overpaid by Medicare. Now, I think that's unfair. Those extras should be available to everyone on Medicare. But people choose to be on Medicare Advantage. Now, if I choose traditional Medicare, can I end up in one of these DCE REACH programs?
Well, I am on traditional Medicare, and sadly, yes. They have the authority to assign seniors and people with disabilities into a DCE or REACH without your full knowledge or consent. They're searching through your medical bills, deciding who they think is your primary care doctor, and then they just assign you to that doctor's DCE. So you still have Medicare, but now Medicare pays the DCE or the REACH, and the DCE REACH pays your doctor or hospital, and the DCE REACH keeps nearly all of what they don't spend on your healthcare. So for the first time ever, there's a middleman in traditional Medicare making a profit from your healthcare. And remember, this is being done to the very people who chose traditional Medicare and said no to all of those ads for Medicare Advantage.
But wait a minute. So if someone doesn't want to be in a DCE, can they get out?
Well, we asked that very question of Medicare when we met with them a few months ago, and they said, absolutely, you can get out. All you have to do is pick a new doctor.
Wow.
We were frankly horrified by that statement. It's not easy to find a doctor whom you trust and are comfortable with, or sometimes a doctor at all, particularly if you live in a rural or other area with fewer providers, and then to be forced to find a new doctor because of this new plan with Wall Street. Well, that's just not right. But what also worries me, Anna, is this: if traditional Medicare is taken over by Wall Street, well, what happens to Medicare for all?
Well, exactly. Half of Medicare is already run by third-party profiteers through Medicare Advantage. Now, the other half of Medicare is threatened to be controlled by investor-owned for-profit DCEs and REACH. And if we don't stop this program now, there won't be any Medicare for all left to fight for.